Okay, lucky number 13 protocol, the Detox System. So this is really, really important for people with pain. We know that we get pain from other areas in the body called referral pains. So one of the things we look for, especially in right shoulder pain, would be liver, gallbladder, right, and diaphragm. And we really want to make sure that we get the detoxifying system moving and working and doing its proper job, right? So 70% of your toxins are eliminated through breathing your breath, through the exchange of CO2 and oxygen in that. Then we have our liver, gallbladder, our two big ones, kidneys, bladder, and large intestine. So I'm going to do 40 minutes, 40 seconds with infrared, and then 50 seconds with red. Again, if you only have one or the other, just do a total of 90 seconds, okay? So here we go. We're going to start, and I like to come to the, almost what they call in acupuncture, the lung 1 points. Now, if someone had something going on, so let's say you had a really bad cold or pneumonia, I might do some more up in the apices up here as well. Maybe come to the posterior part of it. But for the most part, this is a good spot to go. Again, we can do a point or we can do an area. So I like to do a combination, starting at lung 1, acupuncture points, and then coming and doing a large area. So 40 seconds, infrared, and then we're going to switch to doing 50 seconds of red. Again, coming to lung 1, the area. Now, this is a good time, Sam. I want you to do some breathing in through your nose to count of 3. Hold it, count of 6. 1, 2, 3, 4, 5, 6, and blow out through your mouth. So just like step number 4, where we're doing the detoxification, take another big breath in through the nose, count of 3. Hold it, count of 6. Let it all the way out. So awesome to do, again, activation while doing the laser, which is part of number 4, okay? And we're actually into the system here as far as detoxification. So after we go to the lungs, where do we want to go? We want to go to the liver, right? So the liver is going to be right here underneath. There's a liver point, and then the gallbladder is going to be right about there, all right? So we want to do a couple points that are pretty close to each other. Remember, we also have some hertz or frequencies in here that are specific to those particular points. So you don't have to be exacting, you just need to be close. Remember that the laser communicates through the cells. The cells talk to each other. And so this is, again, going back to the matrix and the Ostman's work and Lang's work and a whole bunch of people's work on how the body talks or communicates through itself through this laser light. So we got red. So a total of 90 seconds on the liver. Okay. And then we're going to come to the kidneys. Now the kidney points to, for me, belly button's right about there, Sam?
Yeah, right.
Just a little lower, okay. So I come about 1 inch to the left and right about parallel, maybe just a hair higher than the belly button. So this is a kidney point. Now if you wanted to, you could come posteriorly directly on the kidneys. I just don't like to have to move the patient around unless I need to, all right? So infrared, 40 seconds. So depending on how bad it was, usually I can do this at the same time. So do 90 seconds total for both points, 20, back and forth. If I knew you had a kidney problem, I would increase those and do a whole 90 seconds per point, okay? So you have an option. Don't want to give you too many options, but I'm going to give you one here. So you could do 90 seconds total, or you could do 90 seconds each part, depending on what you're trying to do. Okay, now we come into the red. Starting with infrared, and then going to the red. Now, lungs, liver, also have the kidneys. We're going to do bladder, and then large intestine. I can just feel that it shifted a little bit. Now, Sam, you only have 1 kidney, is that correct?
Right.
All right, tell us what happened on the
It was removed when I was 12 years old. They said it had never functioned.
Never functioned, okay. So we know we have a compromise here, and I could tell you when I was just on this point, which one was removed?
Right one.
Right one was removed, okay. So even though he's had one removed, I'm still doing the point, the acupuncture point, okay. So don't get too caught up in that. I still like to do the acupuncture point, even though in this case, we know that he doesn't have that kidney, all right. So that's pretty cool, all right. Now, we're switching back. We're gonna go bladder area, right? We're gonna see a lot of this, especially with people that are incontinent. Sometimes it's just a virus, bacteria, or some infection, or high sugars will cause us to urinate quite a bit, and that's part of the detoxification. So we're gonna do the bladder area as well. 40 seconds of infrared and 50 seconds of red. Okay, so speed this up. I'm just gonna let this go back to red. You can see that there. Now, large intestine, we know is a big area here, so I'm going to do different points once I finish up with the bladder to encompass both the ascending, transverse, and descending colon of the large intestine. Okay? So we're going to start over here with infrared, and I'm going to now paint the area, not so much a point, but I'm going to paint the area. So we're going to come up the ascending, transverse. Again, I got a whole bunch of different areas here in this large intestine. A lot of different feet in that intestine. Encompasses many, many feet. So I'm painting the area, then I'll switch and I'll go to the red. So there's a lot of different things that we can accomplish using the detox system. Now, this will be used in conjunction. So after he had all that anesthesia and all those medications in the hospital, would it have been nice to do the detox? Absolutely. So you can add to things as you go. So detox is really, really important, especially after any type of surgery, anesthesia, any dose of medications that he had to be on for a long period of time, especially the pain meds, the opioids. This is going to help push out the tissues in throughout. Now we know that this is going to be excellent for multiple different things. All right, so that's the end of the detox.